Everyone, in this lecture we are going to discuss about fungal disease candidiasis. So the candidiasis is caused by the organism Candida albicans, which is unicellular oval shaped dipurid fungus. It is a form of yeast. So it has several different morphological forms and it reproduces through unicellular budding, yeast to true hyphae, parallel side walls. So this is its morphological characteristics of a Candida albicans. It has different morphological forms. It reproduces through budding and can form true hyphae, which are parallel side wall pattern. So these are typically harmless commensals, but in higher concentration or due to some unfavorable conditions or during favorable conditions, they become opportunistic infections, and mainly the effects on skin, genitals, throat, mouth, and blood. Epidemiology. So the Candida albicans or Candidiasis occurs in 75% of the women suffer from Candida albicans infection, usually vulvovaginal candidiasis in their lifetime. So, candidiasis is the fourth leading cause for nosocomial infection, where the infection can spread from the hospital equipment while the person undergoes surgeries. So, this is the fourth leading cause for nosocomial infection in patients' bloodstream. Increased risk may be metabolic disorders, including diabetes, overweight people, and women consume contraceptive pills and who works in the wet conditions, especially HIV positive patients, suffers from this fungal disease known as candidiasis. So the candidiasis spreads at different parts of the body. If the candidiasis occurs in the mouth, it is known as oral candidiasis or oropharyngeal candidiasis or thrush, oral thrush. If it spreads in the genital area, it is known as yeast infection. If it in case of babies, it is called as diaper rash. If the infection is in the bloodstream, it is known as invasive candidiasis or candidemia. Pathogenesis. Candidiasis is caused by the abnormal growth in Candida albicans, which is usually due to imbalance in the environment. So, due to the imbalances in the environment, it may become into an opportunistic infection. Usually, this kind of imbalance occurs in women's vagina, less likely to occur in man. So, events that spark the imbalance in Candida albicans are antibiotic use can decrease the amount of lactobacillus bacteria, which decrease the amount of acidic environment, and due to pregnancy, uncontrolled diabetes, impaired immune system that sparks the candidiasis infection. So, Candida albicans are able to take the advantage of the conditions and outcompete the normal microflora, resulting in candidiasis or yeast infection. So, whatever the condition we have discussed here, the antibiotic usage or during pregnancy, uncontrolled diabetes, and weak impaired immune system, this triggers the Candida albicans to become opportunistic infection and cause candidiasis. So the mode of transmission will be through mother to infant through childbirth and remains as part of normal human microflora. So the transmission is mother to infant through childbirth. Childbirth is common and it lasts as a normal human microflora on the body of the child, So if during some imbalances, this kind of microflora will trigger infections. Changes in normal acidity of the vagina also leads candidiasis and rarely spread through sexual intercourse. What are the virulence factors of candidiasis? So cell-wall adhesin proteins promote the binding of organism to host cell via hydrophobic interaction and spread the infection. Infection of the skin appears as a clearly defined patch of red, itchy skin, often leaking fluid like pus, usually found in between breast, toes, or fingers, folds of the buttocks. Vaginal yeast infection leads to itch or burn during urination. So, there is one condition known as Candidal peronecia is a candidiasis of the fingernails. People whose hands rot. So, if this candidial peronecia worsen, fingernails separate, leads to pain, red, swollen areas. So, oral thrush is a one kind of candidiasis which occurs in the mouth. It is characterized by the curd-like white patches inside the mouth, on the tongue and palate and around the lips. Causes cracked red moist areas of the skin at the corners of the mouth. So diagnosis of the candidiasis is on the basis of skin appearance. Occasionally skin scrape sample is taken to confirm clinical findings. KOH smear gram stain methylene blue is useful for the direct demonstration of fungal cells, in which here in this process the smear sample is taken where the 10% of potassium hydroxide is added to the smear sample. So upon the action of KOH, the sample in the sample dissolves the skin cells. The KOH dissolves the skin cells in the samples, leave the candida cells, the fungal cells. So this can be visualized or characterized by the appearance of pseudohyphae and budding of yeast cells. So with this we can confirm the infection of candidiasis. Prevention and control. So the treatment will be through antifungal creams or powders or vaginal yeast infection. For yeast infection, there will be antifungal medications, tablets, creams and ointments. Example, fluconazole. And for cutaneous candidiasis, creams and powders will be prescribed and the areas must be kept clean and dry before uses of this creams, powders and ointments. For deep candidiasis, intravenous fluconazole is given. So this is an to alternative to side effects, leukopenia and neutropenia. And people with low white blood cells often suffers with deep candidiasis, which means they have the impaired mode of immune system. Weaker immune system obviously will targeted by the slight infections like candidiasis and caspofungin or micafungin, and the drugs like amphotericin B, clotrimazole and ketoconazole is given for the deep candidiasis. So for the prevention, so keep skin clean and dry, and health, lifestyle and nutrition must be maintained properly, and the people with diabetes should try to keep their blood sugar under the tight control. So with this we can prevent the fungal infections like candidiasis. This is the brief introduction or information regarding the fungal disease candidiasis. I hope you understand this lecture. Thank you.